All right. Good afternoon, ladies and gentlemen. My name is Nomagugu Simelane, and I am here with the Minister of Health, Dr. Zweli Mkhize, the Premier of KwaZulu-Natal, Baba Usihle Zigalala. As you would know, we had a visit in the port in relation to the ship that is docked here and a few other things. However, the Minister is going to read us his statement and then we can engage. Let me then hand over to the Minister.
Thank you very much, colleagues. The MEC, thank you for the introduction. The Premier, Premier Zigalala, thank you for obliging. I know that we have taken the Premier quite a way out of his schedule. And I think, as you'll understand, I missed my colleagues out in GCIS in Pretoria. We should have been out there together. Unfortunately, we couldn't quite connect because I had come to the province of KwaZulu-Natal and I was supposed to be part of that whole presentation that the colleagues have been giving. So this is in addition to all that the colleagues have been tabling, just to update the public about where we are on the issue of the lockdown. So I just want to add a few bits that I couldn't be with them to be able to add for the public's awareness. I had come down to the province essentially to meet with the Premier and the Provincial team just to brief them as to where we are with the whole program on the fighting the coronavirus campaign. But at the same time, I also wanted to check their readiness in dealing with the situation. And so that was one reason why I was here. I'll probably come back to that issue a little bit later. Secondly, we had come to just to the airport, to the port, to observe an issue here. Again, that relates to the numbers of people that have been asked to be disembarked from the Queen Mary cruise liner. This is a cruise liner that came from Australia, left Australia on the 16th of March, was coming here with about 1,226 people on board, and it was in a leisure cruise liner, and on its way, as it was coming over to this side, of course, we then started having the emergency regulations, and it was amongst those that had to be asked not to disembark, and it was not therefore allowed to come in without very strict regulations. It docked in on Friday and asked for permission to disembark. Unfortunately, there had to be a lot of questions asked about the health of the the passengers and the crew and so on, and it turned out that there were a number of people who had symptoms which were suspicious of the coronavirus, and so the ship was then asked to wait outside the perimeter of the port, and in the process a lot of work had to be done to check the crew, to check the passengers, those who had shown symptoms. All in all, 26 passengers were checked, and they were tested, and they had to wait aboard for the results to be to come back. And in the process, it was found that all of them were negative, although initially there was a suspicion that there could have been someone who was positive for coronavirus. So that actually has been confirmed that they didn't have. But amongst those who were in the 1,226 people were 6 South Africans. So they were therefore informed that the rest of the passengers could not be allowed to disembark, but only the 6 had to be allowed out, and that the whole ship had to be assisted with on a humanitarian basis, so that it gets its food supplies and so on. So that has now been done in the past. I think from yesterday, my colleague, the Minister Balula, has been processing the authority for the ship to dock, And then, of course, the Department of Health has gone through, tested the individuals. They've been tested now twice, and they've been brought out. You would have noticed that when they were disembarking, one of them is from Gauteng, the other two are from KZN, two are from Western Cape, one is from the Eastern Cape. So they will be brought in now. They will therefore be asked to stay in quarantine in line with our regulations. So they will not be going home. So we'll have arranged for them to be quarantined. But the ship will now set off, sail back to where it had come from, to Australia. We just want to indicate that the condition of all those on board is healthy. Everyone is well. There is a doctor on board, and so we are quite satisfied that all the people who are in there don't need any emergency attention from our side. So because of that, therefore, because of the fact that we've got a restriction on ports not allowing any inbound ships and aircrafts, that's what really has happened in this case. We want to thank the port manager, the port health, and all the staff for managing the situation. We also want to thank the captain and the crew and all the passengers for understanding that we are really battling a difficult situation of a coronavirus, and every country has put particular regulations to make sure that we prioritize the health of our own people. So that is one of the issues why they are here, why we are here. We may just mention as well that we had previously received reports of two confirmed cases from another MSC cruise. That was a while back. One was around the ship that set off on the 28th of February and came back on the 2nd of March. We've got a patient in the Free State who turned out positive after disembarking from that cruise liner. The other one landed on the 16th, was on the 13th to the 16th of March, then also turned positive when the ship had gone to the Portuguese island. And so we were looking at that those particular passengers. So we've asked the port manager and the owner of the cruise liners to help us to get us more information, just to be sure that we have tracked everyone who was part of that. We do understand that it looks like it's a bit of a while since they had actually disembarked, but nevertheless we think it's important for us to just have a sense of the whereabouts, just to be able to make sure that we can track all the individuals if in case they did experience symptoms in the process. It's important for us just to close that whole chapter appropriately. So we just want to therefore say to those who might have been part of these cruises that they need to be aware that there were people in those particular cruise liners who were positive, so they need to approach the medical doctors or the government public facilities to be able to be screened properly. So we just want to get a history, what has happened, have they had symptoms and so on, in case there's anyone that we missed. So that's been important. We've been in touch with the managers of the MSC operations. Again, they are prepared to cooperate with us. We just need to make sure that everyone is aware that there's this particular issue that we are dealing with. Having said so, I'd like to then also update fellow South Africans that at this stage we have confirmed COVID-19 cases standing at 1,353, which is an increase of about 46 from the last reported. President did indicate the figure when he spoke to the nation yesterday. So the figure has gone up by 46. Just to also indicate that the total number of tests that have been conducted to date is about 39,500. That is the number of patients tested, but number of tests is close to 42,000, which means there were other repeat tests that have been done in addition to those. Just as a matter of a breakdown, this gives us 633 in Gauteng, which is the highest. then 325 in the Western Cape, and then KwaZulu-Natal 179, and the Free State 74, and then in the Northwest 8, Mpumalanga 12, Limpopo 14, and then Eastern Cape 12, and Northern Cape 6. Then we have still got unallocated, which is 90. Now, this unallocated basically means that with the pressure of the numbers of patients that get tested, we sometimes don't get all the information that we need. I've issued letters now to all the laboratory CEOs to say it's obligatory that all those forms need to be filled. And that information is important because unallocated means a delay in us finding out the identity of the patient, also the contact details, as well as the contacts that need to be followed up afterwards. And yet, the sooner we get that information, the better for us. It's important for us to be able to get this information as soon as possible. This is something that we hope to resolve in the future, because we are updating a lot of our systems to be able to ensure that there is technology that's helping us in and even recording some of the people that we get, and also to make sure that we can go immediately to where there's incomplete information. As the form is filled, we actually find out that this one is incomplete and we go to the doctor quickly. So that we will be dealing with fairly soon. So I hope that we'll be able to clear this one in particular. I may as well also just indicate that these numbers that you are seeing mean that there's been a huge pressure on our laboratory services to report, to test all these specimens. So last week, around Thursday, we started picking up a problem in the system that there were backlogs that we're experiencing. As we checked through the system, we realized that some of the pressure on numbers meant that some of the laboratories were not coping with the specimen that they had. We went through, and this particular laboratory that had the largest numbers disclosed the numbers, and then we actually moved a lot of them and got them to the National Health Laboratory Services so as to even the pressure. So ultimately, we cleared that. By Friday, we had about 4,000, which we cleared by the end of the day. So what I very much want to commend is the cooperation amongst the various laboratories, that they are able to tell us if there's a challenge, and that also they are able to cooperate to be able to resolve the problem. So in this case, we were able to get all the specimens cleared. Now we're watching quite tightly on the system to see that there's no backlog, so that the numbers of tests that are reported must reflect the numbers of specimens that have been taken. We want to make sure that there's no lag in there, because part of the problem has been that sometimes someone gets a test done, but because of the logistics of transporting the specimen, it takes a while to get the responses back. It no longer takes a long time to finish the test, so we want to make sure that we get as close to giving the public live data as possible. So having said so, we've also noticed a very interesting trend in the past week up to date, because the rate of increase of the numbers is not as much as we initially anticipated, which we believe that our modeling, which we have done for the next 3 weeks, we have already showing that we are falling a little behind the figure that we thought we might be reaching this month. It's still too early to say, but I'm just saying that we're just observing that trend. The figures that we thought might be possible by end of, let's say by the 2nd of April, we could have been anywhere around 4,000 or 5,000, but we think that we may not be able to get there. We think that also for the following week, we're watching those numbers. We may not be going as high as the numbers that were anticipated. As I said, that is still too early to say, but I think that the number of factors that we are going to look into that might be responsible for that. The first one, I think, is the fact that we closed the ports of entry, the airports, the seaports, the large number of our positive patients had actually come from people who are returning into South Africa or those who are coming as tourists from some of the countries that are really at the epicenter of the infection. We think that the fact that we don't have that large number, because up to last Thursday, Friday, 70% of the positive patients were actually coming from those from that kind of history. Of course, we have now started picking up internal spread, which is a matter of concern. I think there's been a lot said now about a patient in Khayelitsha, a patient in Alexandra, a patient in Soweto, a patient in Guamashu. This is the area that we've been really very concerned about, that we need to make sure we act quite swiftly to reduce the internal spread, internal transmission. So what we are therefore going to be doing, we're going to be picking up, escalating the testing and screening of the patients. So why I came to visit the province was to be able to see how they're approaching this matter. And I must say that having had the discussion with the Premier and the MEC, and have visited the war room, I'm very happy that KwaZulu-Natal, they are all actually on their course to take the process forward. The approach we're going to be taking is that we're going to be unveiling in the next 3 days additional mobile testing vans, which will be deployed to a number of provinces, particularly with the ones where the problem is biggest, that is Western Cape, Gauteng, KwaZulu-Natal and Free State. And so there will be some sent to KwaZulu-Natal. The approach we are taking, as the President has indicated, we are going to be increasing the numbers of field workers who are going to be doing the testing and tracing. Now, the tracing teams, as of last Friday, were close to just about 5,000 of them, and this number is going to be increased, possibly more than double it as we use more of the community health workers, nurses, and some of the NGOs. We are going to be converting a number of the teams that were working on the PEPFAR-funded NGOs to actually come and give support at this level. A number of NGOs will be working with us in strengthening the support on the increasing the testing. The numbers of testing vans are also going to be increased, and we're going to be using largely at this moment, we're focusing on the PCR testing, which is what we currently are using. So I think the most important aspect thereof is that as we move, we have decided we're going to be very targeted. For a start, we go to what we call hotspots. We go for every patient who's positive, they are plotted on a map. We're now going to target the areas where they've been identified, and then go into those areas, look for people who have got symptoms and deal with them, and therefore triage them so that we know which ones need to be treated, which ones need to be tested, and which ones need to be referred to hospital for care, and who needs to be taken for quarantine. So that is what's going to be happening now. In other words, we're actually scaling up the intervention. If I were to put it the other way, when I said some time back we were, excuse me, when I said the other time that is a combat zone, effectively what we've been doing has been a very defensive or reactive approach, where someone gets attacked by the coronavirus and then they report, then we go test them. Now we want to be able to go out to areas where we suspect that coronavirus could be now have to be spreading, and therefore we'll target those areas, and then we'll get people to go and start testing in those particular areas. So I think it's important for our people to know we won't be going to all the townships every at the same time, but we're targeting those where we want to deal with the already identified cases of positive people or contacts. Already this morning, the Gauteng government had gone all out to Alexandra. They've started the program. I'll be visiting Free State on Thursday. Again, they've also set up their mobile teams on the ground. They'll be moving out. On Friday, I'll be visiting Western Cape. We'll also be rolling this whole issue out. So effectively, we're actually getting our ground operations up and running, and we're scaling up the offensive. And in this case, we want to make sure that we can test people on the ground. This week, we are focusing on using the same PCR test that we're doing. But behind the scenes, we are actually focusing on looking at changing the strategy to look at additional means of testing. So the South African Health Products Regulatory Authority, SAPRA, and the Ministerial Advisory Committee are working on 24-hour basis to identify the kind of rapid tests that we are going to be able to use, because whilst they have not been registered through WHO, many countries have already started registering them and are utilizing them. So they are working flat out to be able to identify those, so that we'll then add those as an additional approach towards widening up and scaling up the testing process. So that is how we're going to be actually dealing with this issue. So from now on, we will be seeing mobile teams that are going to be located in various townships, and as we get more and more of our mobile vans into commission, they'll actually be getting onto the various areas that we will have targeted. It's important for us to do this because, as we have said, we want to get ahead of the curve. Most of the patients that we have are actually recovering well. We reported last time that we have about 31 of them were recorded as having recovered. The number we're quantifying right now is actually growing quite well. We don't have the total figure just now. We'll report that in the next statement, maybe tomorrow. What's important is the fact that most of our patients are actually quite stable, but the numbers that are in hospital are also increasing. But unfortunately, we have had deaths. Yesterday, President announced 3 deaths. We actually have 5 deaths. And so yesterday, we reported the one President referred to is a 74-year-old male who was in 74 in Bloemfontein, in Mangaung. Yes. In Mangaung. So that one was a particular person who was part of the church experience, and he passed away. I'm sorry, I said 4. It should be 4 deaths. And then we've got another one who has been reported in Gauteng province. That in Gauteng, also an elderly man who was 79 years old, who had a complication of the problem of the chest. He came with chest distress. There has been a report as well in KwaZulu-Natal that we are actually going to be verifying of a younger lady at about 46 years who had underlying problems of hypertension and chronic asthma. So these are the ones that we have actually identified, but I think it's important to note that some of the conditions that people might be suffering from, which we call concomitant diseases, sometimes once you get the COVID-19 infection superimposed, it tends to create a challenge in that case. So that is the one area that has been our concern, as it were. So having said so, I think we just want to say to our people that we believe that the step to undertake the lockdown has been a very helpful step. It was important, for example, to say that people need to understand that the message remains strong to keep hygiene, hand hygiene, block nose and mouth when coughing. It's important, but also to stay at home, because the reduction on the traffic on the taxis and the trains actually means that the potential infections actually are averted. And that for us is a very, very important issue because it allows us space to continue to flatten the curve. And therefore, once we reduce the numbers of people who come from outside the country and those who come from the affected areas and ensuring that they are quarantined, we are picking up quite a number of people who are still positive, but then because they are quarantined, they are restricted in the areas where they are not causing any potential infection in the community. So we believe that all of those things are quite important as we are watching how the infection rate is increasing. We do expect that when we get increasing the scaling up the infections, the testing of the infections, we will actually find that the numbers might increase. It will be because we are targeting. But I don't feel, personally, as I look at it, I don't feel we are very far behind the spread of the infection. Especially even if you look at most of the countries and the rates at which the infection is going, at the rate at which their deaths are occurring, those are some of the issues that makes us feel that we really have to work together and work very hard to fight against this case. It remains a very serious infection. It also becomes even a challenge as we go into the cold winter months, because there you're going to be having flus, more the influenza type infections that tends to complicate the situation. So that is an area that we become very concerned about. We are at the moment working very hard to make sure that our health workers are protected. We have indicated that we'll be focusing on ensuring that the flu vaccine is administered on many of them, and also the issue of personal protective equipment is something that we are working very hard on. So you have noticed that there were concerns that have been raised by some of the unions. Now, those are our staff members who are pointing out some of the areas which you need to address in terms of the adequacy of the protective gear. But we are working together with the manufacturers. We are actually having a full sight of what is available both in the hospitals, in the private and in the public, as well as amongst the manufacturers. So we are actually on an understanding now that whatever is available on the producers of our protective gear is going to be destined for South Africans to use. So it's a matter of just moving from one side to the other. You would have also heard that my colleague, excuse me, my colleague, Minister of Transport, we have been discussing the issue of giving support so that some of the people, as they move in the taxis, we should try and assist to get some of the masks available and so on. We're engaging the manufacturers to be able to work with us in that regard. The President has announced, as we have seen, some of the offers and donations that we might be able to get, and in that process we're prioritizing the protective gear, we're prioritizing the additional equipment that we want to use in this case. We have actually looked at the numbers of beds right across the country in terms of the public, the private. I don't have the numbers here just now, but what we are doing is we're looking right across to see where we need to be increasing the numbers of beds, so that if there's an increase of pressure that comes to various provinces, we should be able to respond appropriately. So let me say at this point, therefore, that I know that the Premier is due to move to another meeting, but I want to say that having had the briefing with the province, I'm very pleased that there's quite a lot of support across the government for the campaign on fighting COVID-19, and therefore maybe we might just ask that Premier makes a couple of comments on the same issue, and then we can entertain some of the questions. Thank you very much.
Thank you very much, Minister. I'll hand over to the Premier.
No, thanks. Thanks, Honorable Minister Dr. Mkhize and MEC Zulu. We also would like to join the Minister in emphasizing that for now, all of us should be focused in ensuring that we consolidate the efforts that have been put in place by government. I think the first important thing is for all people to stay at home. The lockdown still applies. It applies to all of us. It needs to be adhered to. And we all need to ensure that we follow all directives. But secondly, we want to thank the national leadership, both the President, the Minister, Dr. Mkhize, as well as all ministers, for giving leadership on this issue. I think the national government have provided leadership that is correct and needed. I think many people were found wanting on what was going to happen and how South Africa would respond. And the manner in which our government have responded brings hope, but also it seeks to tackle the challenge direct. We are also in line with the view that is suggested that it will be important that we try to scope and look for all people who have been infected, but on top of that, ensure that we look for contacts so that we flatten the escalation, try to cap the escalation of the infections. So we will support the initiative of a rapid test and the mobile units that the minister is talking about. We believe that the number that has been presented by the minister poses a challenge to all of us. And it is therefore important that we cap the spread of the virus before it reaches many people. In KwaZulu-Natal, I think it will be incorrect for me if I don't appreciate the support we have received from various stakeholders, the business community, the religious leaders, traditional leaders, but also municipalities. In district, we have activated all our district command teams, which are aligned to OSS, and all of them are responding effectively. And that makes it easy for tracers to be able to get necessary support so that they are able to get the contact whom we are looking for. With regard to MSC, I think the minister did allude and clarify that point. I'm not going to report again on it because the minister did cover it. Thank you, MEC Smilanizu.
Thank you very much, Premier. Ladies and gentlemen, that is then our report. Let me note hence and request that colleagues, you introduce yourself, your outfit, where you come from, and then you take questions. I'll start with that question. Second one. Third. Okay, that's fine.
Minister, my name is Koskona Duma from Eyewitness News. Minister, maybe let me start here. There is some confusion about the wearing of masks. Some are saying that COVID-19 is airborne, and others are saying it's not. Others are saying that the masks actually exacerbate the risk of you actually getting infected. Can you please just give the country guidance in regard to the safety tips? Minister, now that this virus has arrived in densely populated areas such as Khayelitsha, as we now note, how is that program that the national government is planning to implement of actually opening up some public works buildings to actually host some of the people who are positive and those who may need to self-isolate? And just lastly on my part for now, this lockdown, we previously indicated that we might have to wait a bit before actually seeing the results of it. Can you just please give an indication of when we may see the results of this particular lockdown? And just lastly, what in your view would inform the extension of the lockdown if it gets to that point? Thank you.
Thank you. Second question.
Sihle Mabuso from Independent Media. Just two questions. Minister, we've already told us that there is pressure on our laboratories. Do you have a plan to ensure that the mass testing that is about to take place doesn't put more pressure on those labs? Secondly, can you confirm a case that is reported in Umlazi? Yes.
Mr. Oren from the Sunday Times, just confirmation, just clarity on the number of deaths. Understood you to have said 5, but I believe it's 5. It is standard 5. Just clarity, please clarify that for us. And then certain allegations, Minister, had made by nurses around the country, saying that initially they were informed by the Department of Health that if they had to deal with patients related to the virus, they would have to be quarantined and isolated somewhere, with either in the hospital or somewhere around the country, but they're being sent home. So we've received those allegations from certain nurses. There was also an incident in Valcom at the Bongani Regional Hospital. I'm not sure if you're aware of that, Minister, where action had to be taken against nurses who had gathered and were protesting regarding not having sufficient safety gear to treat patients and resources. And then just a quick one, Minister, regarding temporary structures. Would the Department of Health be considering, or would they consider temporary structures being erected? We've seen it happen in China and Russia. There have been a number of private companies that have come forward to say that they can put up temporary structures in as quick as 12 days in the country. So just want to know if the department is exploring that aspect.
Thanks. Those were the 3 heads that we had. Minister, I'll take the question that was talking to Public Works, because I think that relates to the province.
Okay. So
As part of the planning.
you want to come and sit here?
Oh, I can stand, Minister. No, thank you. I thought that I needed to respond to the question that relates to Public Works, because that talks to our planning as a province of KwaZulu-Natal. Of course, you know, we hope for the best but plan for the worst. As part of our planning for the worst, we decided that we needed to identify bigger spaces where, should need arise, we are able to accommodate the big numbers that we might have to face if that comes, if that situation comes about. Now, what we decided to do is to identify not just Public Works, but all buildings that are owned by government in the province of KwaZulu-Natal. Of course, you would know that those buildings would then be under the asset register of Public Works, and we are working towards identifying those. In identifying those buildings, and I think I need to be specific here because there has been some confusion. Some of the buildings that we are looking at is schools that used to be utilized previously but are no longer in use. We are not going to be looking at schools that are being used currently. So we've got quite a few schools that the Department of Education had handed back to government and said we are no longer utilizing these facilities due to a number of reasons, because the children are no longer viable, and you know, we call them non-viable schools, and that had to be closed down. So we are looking at that, but we are not just looking at schools. We are looking at government buildings themselves, including the buildings in the city center, buildings in eThekwini, buildings in Gudlov. In fact, we are looking all over the province, but we've not stopped there. We've also looked at facilities that are owned by government, where these are owned by agencies of government, where are being utilized, and we have enough beds that we could use. So that is a program that we have in place. Next week, when we meet as the Executive Council and we have a proper plan that has been tied up, we will then be able to announce. You will remember that in our reporting, it is some of the things that we have been reporting to say we've identified a number of hospitals. However, we are also looking at ensuring that we use some of these beds. I must also indicate, Minister, that we have had a number of offers from the private sector, in particular, some donating buildings, some saying, look, we are hotels and we are not getting any business right now. You could use some of our facilities, and we are having those engagements all over the province. So the bottom line is that we will be using whatever beds that are available as soon as we need them. Thank you, Minister. I think that's the only one that was relating to the province.
Yeah, may I apologize? I think a bit of confusion as I was trying to give you the specifics. I want to say, deal with this issue of deaths again. It's 5 deaths. Okay, the first one was in Western Cape, a 48-year-old lady who had an underlying problem of thrombosis and embolism, and that we reported already. The other one was in Free State. Okay, the other one was in Free State. 85-year-old male who was part of the church, the original church where a number of people got infected from. He was admitted over the weekend and also passed away. The other one is in Gauteng. This one was a gentleman that had also no history of travel, but had been in Cape Town and was around Krugersdorp, and he was admitted with respiratory distress, and therefore he succumbed yesterday or 2 days ago. Then there are two in KwaZulu-Natal. One is a 74-year-old male in Ladysmith, who we reported already. Then there's a 46-year-old lady who had chronic asthma and hypertension. That's the one that I think you might be reporting, who came from Mlazi. That's the one. The other issue you asked us about was the use of masks. There is no question about the fact that the masks are actually one of the best ways of preventing spread of the infection, and we would recommend them in particular where people have got any cough or any symptoms, or in a situation where social distance is a bit difficult, so to make sure that people can use those masks where possible. So the issue of COVID-19 being an airborne infection is actually something that came out in the papers, but WHO did dispute that. As far as we are aware, it's a droplet infection, which means that it's got a risk of spreading to people who are in close proximity within a meter, and therefore, and those where there could have been droplets that would have fallen to the surfaces that are being used, in which case between 9 to 12 hours they could still be available, they would still be viable to actually cause infection. Of course, it means that you might also be in clothes and so on, you might have that problem. So as far as we're concerned, yes, masks are still very useful. They are just one thing that I think we must actually use as much as is possible. So I don't want us to have any doubt, whatever might have been said, but we shouldn't have any doubts about the fact that masks are actually useful and recommended. How long do we see the lockdown for? I don't think that anyone can say that. Right now we've got 3 weeks. It's the 3 weeks during which we need to be able to deal with the effort to reduce the rate of the spread of the infection. Thereafter, we're going to be assessing on a day-to-day basis. We're going to be assessing as we get closer to that time. Obviously, I think we will not have life as normal after the 21 days. There has to be adjustment in the way we behave ourselves, in the way we do things. There has to be adjustment. I think many countries have had to track for several months before they saw a change. Some countries still haven't seen a change. But there are a few countries that have been very exemplary for me as I've been looking around. One is China, which despite the huge load, burden of infection, they were able to actually contain this, such that today China is number 4 in the world, when in fact it was number 1 with anything, with no country anywhere close to 5,000-10,000 for a number of weeks. Today China is actually becoming the one of the ones that's got the smallest number. I think China is number 4 now, with the US, with Italy, with Spain, and so on, really racing ahead. So anything can happen to any country. I think we need to be aware of that. The other country that I found to be very impressive is South Korea. South Korea was the second largest country in terms of the spread of the infection at the beginning, and so right now it's dropped to number 13 if you compare the countries in the world. That means that you can do something and actually have an impact. But I think amongst those issues is a change of behavior, social distancing, also use of masks, and also people really following the guide that this is going to cause infection, let's avoid this, and so on. I think that has been a very good lesson. So whatever happens after the 21 days, we must know that our behavior has to change completely. And this idea of people sending around fake news and telling people about stories that this infection doesn't affect black people, it's only for white people, is wrong. It's not true. That no, it's for rich people. If you are poor, it doesn't affect you. Again, it's not true. That it will not affect you if you don't live in a suburb and all of that is not true. I think people must stop believing in fake news and believing in things that are going to make it difficult to manage the infection. What I think is important is for us to always take seriously when there's an infection. In this case, we also want to warn people that if you are advised to stay home and be in quarantine, you need to accept that. We've actually had to charge a number of people for not adhering to the quarantine. I was just talking to the MEC and the Premier here, who were telling me about how, since we have said everyone, even if you are in a hotel, you must stay in quarantine, they suddenly found in one hotel, when people were normal tourists visiting the country, enjoying themselves, they found that 12 of them actually have just tested positive. Now, if they'd been moving around, they would have been obviously have affected other people. But they listened, they sat there. Now we will wait for the 14 days, they'll burn the virus out, they'll be treated and everything, and things will be fine. So I think it's important for us to know. It's really more important as we move towards the winter days, because then the impact of the viral infections, all sorts, is going to be heavy on all of us. So we need to therefore understand that all these precautions are actually helping us to get ready for the time when, without COVID-19, we would be having a problem of influenza, flus and colds and sneezing and coughs. All of that, when now there's on top of it some COVID-19 infection on top, it makes it more complicated. So I think it's important for us to understand that when we were asked to stay at home, it was for the good of the nation. When we were asked to stay at home, it was to reduce the infection. In fact, as I said, our modeling is already indicating that maybe we can actually make an impact. So it's still early, as I said, I don't want us to spend too much time on it, but just to say that if we can stick to the guidelines that have been given, we would be able to actually make an impact on the infection. We need to chart our own history. We need to chart our own conduct of how this whole viral infection has been dealt with. It will not be the same as all other countries, but it can be very different if we actually think we're just going to be carefree about it. But if we take all the lessons from the other countries, we'll be able to make a huge impact, and that's why, for me, it's important for us to make that plea to our people. Now, the question about the pressure on the laboratories. At the moment, a few months ago, if you ask for a COVID-19 test, it would take 2 days, 4 days, and so on. Now it's much more rapid. We've increased the capacity. We've created more equipment. We've found more equipment to be able to create capacity that allows us to test as many people. If you look at the numbers we're testing now, we're able now from late last week to be able to test up to 3,000 to 3,000 tests in a day. So that's why, for example, last Friday, we could say that it was possible to clear a backlog of 4,000 tests that were actually stuck. So our capacity is improving. We're not worried about that. We believe that we're going to be improving the capacity as we move on. That's the one aspect. The other aspect is that these rapid test kits, we also want to use those as well to add on our own capacity. Now, these two are interesting because for a while we didn't want to use the rapid kit test. We're not under that pressure. But also the challenge with those tests, it's important for us to get the consensus amongst all our clinicians and academics so that we can actually use them in the same way, because the way the tests work is not the same. The first one that we're doing, which we're using, which we call the PCR test, those tests basically pick up the presence of the viral particles, so they are able to show you an active disease. Some of those rapid kit tests are showing what we call antibodies in the body. They actually show the body's response to the fighting the virus, which means it can be positive now, but we might have finished fighting the virus and so on. But that's not a big issue. Those are issues which clinicians and academics and researchers can worry about. In our case, if that's going to help us to be able to scale up the testing, we're happy to move on with that. So we're hoping that all of these issues will help us to be able to get registered kits, rapid test kits, which we can actually use inside the country. So all of that is something that's on course as we speak now. The other issue you raised about nurses who are making allegations, I think it helps if we just get direct allegations so we can investigate them, because if nurses have a concern about safety gear, I think the management needs to address that, and we must really be upfront with that. Anyone who needs to have the right gear needs to be assisted so that they don't get exposed. So it's in our interest for our nurses to be well protected, because they are our force in the fighting against the infection. I'm not aware of the details of the Welcome situation that's been asked about, but I can check that and find out what happened in that kind of situation. Except that we must just say that any health worker that raises the concern around the safety gear, protective gear, I think they are entitled to that request. So it's something that we must just address and talk about. If there are delays, what are the delays, for how long, and what can be done in the meantime to make sure that their situation does not get to be worsened. The question of temporary structures, well, we can't rule out anything. Our first point right now is to go for existing buildings where we can utilize the buildings to utilize them for extra beds, where we need to be able to locate extra beds. That's been done in every province, and we've said right up to every district there must be centers where we are able to get extra beds to admit other people. Also, if we need to scale up the numbers of beds, we're already looking at bigger sites where such beds can be accommodated, where we can accommodate 1,000, 800, 1,000, up to 2,000 beds and so on. We're looking at those options. Those are things that are part of the plans. We won't announce it until something concrete has been done there, but we're actually advancing looking at all those issues. The reality is, as MEC was saying, we haven't admitted many patients. The last I checked, we had about 55 or so patients were admitted. Most of the people were not needing to be admitted. However, we want to always be ready ahead of the outbursts. If the viral infection were to in any way increase, then we must be ready to be able to manage those kinds of situations. That is why you would have heard that there's been talks about also increasing the numbers of ventilators that are available, where we've had a discussion with the medical device manufacturers to say we need them to already start building up an additional stock of ventilators just in case we need them. We don't want to be caught unawares. We want to be ready ahead of time. And we want to say that as we see the disease progress, we'll be trying our best to try and reduce the rate of spread, but at the same time we'll be preparing in the event that the numbers of people that need to be hospitalized is increased, that we must find ourselves ready to be able to deal with that situation. But again, we have got a lot of support from private sector, from non-governmental organizations, from communities. People are coming forward to say, what can we do? We believe that's a very good spirit to be able to fight this kind of virus, so that all of us must know we're in it together. This is not coronavirus is not going to be a battle that's going to be fought by the nurses and the doctors. It's a battle that's going to be fought by individuals, by communities, by families, by society at large. It's important, therefore, for us to be able to say, when we deal with this issue, we're dealing with it with the understanding that it's about saving our nation. It's about saving each and every one of us, so that we should not lose anyone as a result of this infection. That, for us, is what we would like to be able to send as a message across. That for those who find that there are challenges with the lockdown, please bear with us. We're really doing it for the best of our country. We do understand that there are challenges in a number of areas. What President and Cabinet has insisted on is that we need to make sure that essential services, particularly food, should be available to our people. So people must not be dying of hunger whilst we're trying to fight the disease. People must be able to reach out to where they need, excuse me, to where they can get food, so to where they can get essential services. It's important for us to remain open and flexible for that. Thank you very much.
Thank you very much, Minister. Just one last round, colleagues. Okay, I'll start with Spamandla. Is it a follow-up?
Yes.
Okay, wait. I'll start with Spamandla with the second one. 3, 4, 5. Those are the last heads, ne? Okay.
In the Free State, Minister, how far have you gone with the tracing of all those who attended that church service? When you addressed the South African Medical Association in Pretoria, you said you were in favor of drive-by testing in densely populated areas. Do these mobile vans you talk about form part of that? And also, if you can give us a breakdown of the health workers that will be doing these massive or mass screenings and testings, please. Thank you very much.
Thank you, MEC. This is just a follow-up. Perhaps you can also chip in, MEC. It's just a follow-up on the number of beds that are already available, because you do say that many people are offering you, but can you just give the country a figure? Also, I understand that, Minister, that the country is in the process of developing its own testing kits. Can you give us an update about that? Are we already in motion in that regard? If so, also can you help us with figures in that regard? Thank you.
Minister, hi, it's Kavil Singh from News 24. You've indicated the mobile sort of testing that's going to be rolling out in a mass scale in just a few days, which is excellent. Can you indicate, right now you said there's 39,500 people that have been tested. What's your target for the mobile testing in terms of the amount of people that you want to reach? And what sort of measures will be taken to protect the healthcare workers on the ground that will be conducting these tests? Thank you.
Minister, it's Kayleen today from the Mercury newspaper. Just talking about the MSC cruises, there's now 2 cruises where 2 passengers have been tested positive. On these cruises, there's more than 3,000 people that go on these cruises. Are we potentially looking for more than 6,000 people that may have come into contact with these 2 passengers on 2 separate cruises? How are we handling that? And do we have have we made contact with all passengers? The second question is, we are looking at mobile teams going out to various townships and hotspots. Which are the hotspots here in KZN?
Nushera Subial from East Coast Radio Newswatch. I just would like to know, Minister, you spoke about people who were directed to go into quarantine after testing positive, but don't do that. How many people, if you do know, have been arrested because they actually didn't take the orders and walked around, and how many people have they come into contact with? Can you give us a breakdown of those cases? Also, you spoke about deaths earlier, Minister. You said 5 and then you went back to 4 and then back at 5, I think. But I want to know the Umlazi woman who would be potentially the 5th person. Do you have more details on her, and is she confirmed at this stage?
That's the last one.
Okay. Thank you very much. Let's start with the last question. This is the unfortunate death that's happened a few hours ago, and we do wish to convey our condolences to the families. In terms of our report, she is a 49-year-old lady who's sorry, 46-year-old lady who was admitted with hypertension and chronic asthma, and then tested positive in the process. So that one, as far as we would be aware, that's the information we have. and we believe that's confirmed. And so the number is 5. I did have a bit of a quibble at some point, but that was just an error. The number is 5. As I did say, the number, I actually went through the whole breakdown. The 46-year-old lady in Durban. Then there was also a 74-year-old in Ladysmith, we reported already previously. There was a 79-year-old in Gauteng. We had not reported that one. We're reporting that one for the first time at this point. Then there's another one who's 85-year-old in Free State. That was reported by the president yesterday. Then there's a 48-year-old who was in Cape Town, Western Cape. So those are the numbers that we have. Those are confirmed. Then the question is, how many people have broken the law? It's difficult to remember everyone. We didn't count, but you might be aware there was someone was charged in Ladysmith for attempted murder. There was one that the Gauteng MEC went to court to actually enforce the quarantine. There is the one that I think MEC has also had one in St. Lucia, who was informed in Kruger National Park that he was positive. He continued to drive all the way and came to St. Lucia, and then they were just about to embark on a boat. They were stopped, and then that one was charged. The other ones, we didn't charge them, but what happened was they moved from Kruger Park and came to Maritzburg, got tested, and then instead of waiting for the results from quarantine, they drove further to the Eastern Cape. But what we then did, we then got the health authorities and police to go and wait outside that hotel and actually asked that nobody must leave that hotel, and they were left in there. They were now in the hotel, and so that's the number that we can think about. I'm sure there are a few others, just that we didn't take note of them to be able to respond to in that way. And then around Free State, I'll have to open up to check for you how many contacts have been traced in the Free State. The last were checked, there were close to, I think, 1,400 that were traced, but I will just double check and make sure I've got the correct number for you. But the issue of drive-by testing, it was an important addition to the approach to increasing our testing capabilities. So that will still be part of it. When we talk about mobile van, we were looking at, firstly, the vans that are going to go out. Then we will then be able to set up sites where we'll say people can come past and test. As our numbers of vans increase, we'll be able to do that. So that's still pretty much part of our strategy. The health workers, now to do these tests, the doctors have to do the swabs. In this case, we get the doctors to do the swabs. For some of the test kits, some of the rapid test kits will actually be using nurses and doctors, so it will be done by professionals. The question of protection, they have a known gear that they will be able to have when they do the test. They'll have the full gear that is used when people are doing. Because when you test anyone for coronavirus, you assume they've got it, and so you treat yourself as though you're protecting yourself against someone who's already confirmed. Then, look, the numbers of beds at the government level, we've got just about 87,000 beds around. Obviously, for purposes of COVID-19, we've got, we've identified the number of hospitals. The numbers of beds, we would have to add them up because we keep increasing them as we move. Originally, we just counted the number of hospitals, but now we've said they must now be counted in each and every district so that we know, how, if even up to a point of small towns now, must look for space where we can potentially be able to put beds. Sometimes even if they're not there, but they should be possible to deploy within a very short space of time if the situation arises. We're not manufacturing our own kits, rapid test kits. However, there are a number of options that we are looking at. The first lot that I spoke about, the rapid test kits, are the type that we say, that I said is about checking for antibodies, which is, there are a number of countries that have got these kits. We're wanting to validate them and make sure that we get the most credible, and therefore we'll get them out. Those are the ones that we're going to use in addition. But as we're going about with these rapid tests, these mobile testing, we're still using the same tests, which is what the 39,000 that I spoke about, which are throat swabs that you do PCR on. So those will still be the ones we use. Then once we get to increase the rapid test kits, we'll then be explaining the approach, because that will use a slightly different one. There's another type of test that we are also exploring, and that is what is called GeneXpert. Now, GeneXpert is the same equipment that is used for testing tuberculosis. It's fairly sensitive, and it also works very within a very short space of time, about 45 minutes, you will get your results back. And it's already using the same type of equipment that's available. However, because it has not been properly validated and properly registered, we're not there yet. So once it's sorted out, we can talk about it. But just to say, in case what you're referring to is that question, I'm just responding to that. Then, okay, the issue of the cruises. When we got the first patients, we did follow up. But what we're now doing, because we have been going back to try and look at the records, we want to just make sure that nobody is left behind. We just want people to come out and say, if you have not been seen and you have been part of that cruise, just show yourself up. That's really what we're trying to do. And the MSC Cruise Liner is a reputable company. They've been out there, they've been very responsible for tourism and so on. But because of this new disease, we have actually discussed with them that they'll give us all the names. We'll then recheck and make sure that we didn't leave anyone outside there. It's still important to know if there's anyone, even if they might no longer have had symptoms, even if they might not have had the infection, we just need to be sure we have covered our tracks. That's really why we're making the announcement at this point.
I agreed on the last round.
Just fake news.
Wait. I've not taken it.
Minister Nabila Sheikh from ETV News. Just one more question. Actually, I'll put them both together. So we've been informed of another death in KZN. This was issued by the Islamic Burial Council in the Stenga area. They had issued it to the community as a notice because it was the first death where it had to be handled in accordance with Islamic rites. So we haven't heard about this death from you. That death took place early this morning according to the statement that they had issued. And I've personally confirmed this with Zweli Mkhize of the council. The second is about the hotspot areas. Are these areas going to be made available for public knowledge so that people actually know where these hotspots are and they can avoid them?
Just one question, Kabazela. I hope you are going to help us. There are people who are saying there is a link between 5G and the coronavirus. What can you say about that? Because it's out there and people are talking about it. What exactly can you tell the nation about that?
I'm glad you said they raised that because it is something that on social media is talking about.
Just closing, the issue of these mass testings, how are you going to deal with the issue of criminals who would abuse this when they go to communities. I'm asking this in the context of a case in Pietermaritzburg, Sweetwaters, where a 76-year-old was raped and killed allegedly by people who posed as soldiers who were coming to houses to sanitize those houses or people. How are you going to deal with that element of criminality, working with the police, of course?
Thank you.
Sure. Well, it's going to be very difficult to deal with a situation where people begin to impersonate police. We can just make a call to say to our people that it's inhumane what has happened. That you can have someone being raped, someone walking to their house under the false pretenses. It's completely unacceptable. We condemn that, and we hope that the police will be able to find those people. I think that it's going to be important for us to make sure that the police and the soldiers are aware that whenever they get into the home states, they must be able to have the necessary identification and decorum to be able to make people to have the comfort that they're dealing with the real security forces. But it's very difficult to predict what criminals can do. So I think communities, when we find this out, we need to just work together to expose those kinds of elements and help the police to apprehend them and deal with them as soon as possible. It will really be a problem when people are going to fear to respond and respect security forces simply because there have been some who have actually impersonated the police. It's unacceptable and we condemn it. The other question raised 5G and COVID-19. I think we are dealing with a lot of fake news here. The reality is 5G is more a technology issue, and the COVID-19 is a real infection. It's an organic infection that's based on a living viral, viral agent. It's not something that is you can link with any kind of technology, as it were. The form of spread is well described scientifically in terms of all the viral agents. The behavior is the same. It is well known. We've actually tracked this virus to say it comes from animals, and this was a zoonotic transmission from animals to human beings, which is what caused the problem. And it is not something that you must go around scaring people. You must tell them the real truth about it, that it is an infective agent, that you can prevent the spread, but it can be very serious as well if you don't take care of yourselves, and it can complicate, and it's something that you can fight and defeat, but it's something that we must have true information. So we need to use facts to fight coronavirus. We can't use fake news to fight coronavirus. If we actually believe in fake news or spread fake news, we're actually undermining the fight against coronavirus. The other question which was raised was the kind of contacts that have been traced. Okay, the Free State numbers, 1,619 contacts have been traced. 1,619. That takes the total of all the experiences of the Free State. Then, those were identified, and 921 have been traced, and then they are finishing off the 698. Of those, there were specific in relation to the particular original church. There were 401 people that had to be tracked on that one. And out of that particular experience of that church, 31 people tested positive. Right now, the number in Free State had gone up to over 70, and of course, some of them were people who were leaders of the churches that they've now gone out to their own churches. So we're continuing to track that one. Then the one case that's been reported by the mosque, I'm going to check on that. I have not been alerted to that. If it happened this morning, obviously I'll still be able to get proper feedback, because not everything that would have happened today I would be able to have full knowledge of. But as soon as we get back to get the daily briefings, I'll be able to get all of that confirmed if that's the case. Then the hotspots, the value of the hotspots is not so much that people must avoid them. The value is that people who are in those areas must come forward for testing, so that we can actually find the virus wherever it might have spread and make sure that we deal with all the people who might have been infected. It's not to say now run away from this particular place. There are people who are infected in various parts of the country. It doesn't mean you run away from that place. It basically means that if someone is in quarantine, they must stay in quarantine. If someone is actually taken out, for example, there will be those who will be in an area where it's difficult to ensure that they can have a quarantine in their own home because of the setting in which they are, will find a place for them to go to. After 2 weeks, they'll have to come back, then we know that they are actually safe. So the idea is not to stigmatize an area or the people. The issue is to say, when we deal with a particular area, we're trying to clear the infections from the people who are in that area. We're not trying to make people to look at it and stigmatize it and fear it, as it were. So the approach, therefore, is that let's have a very compassionate approach in understanding this issue. We mustn't use an approach that makes people fear, run away, or stigmatize those who are infected. After a while, someone will be over the infection, and if you get an infection once, so far, after it's been cleared, you will not spread it to other people, and you may not get it from someone else. So we mustn't have someone where we say, well, he has had COVID-19, so don't get close to them. Once they are negative, they are negative. Once they are over the infection, they are over the infection. The real issue is that you need to worry about yourself. Aren't you going to get the infection and be the next one actually who's got the infection? So I think people must know this virus is going to be here with us, and we need to just make sure that we are compassionate to each other as we manage it. Thank you.
Thank you very much, Minister. Ladies and gentlemen, that is a wrap.
Uthini?